CDC has confirmed an additional 5 infections with novel coronavirus in the United States, bringing the total number of confirmed positives in the U.S. to 11. The new cases include 1 patient identified in Massachusetts and 4 more patients in California. 4 of the 5 patients have travel history to Wuhan, China. 1 patient in California is a close household contact of another patient in California. This is the second instance of person-to-person spread in the United States. We expect to find additional cases of novel coronavirus infection in the United States. We expect to see more cases of person-to-person spread among close contacts. We are also putting in place measures to detect this virus among those who are allowed entry into the United States, who are entering the country within 14 days of having been in Hubei province or the rest of mainland China. All of these passengers will be directed to one of 11 U.S. airports. At those airports, American citizens and exempted persons who have been in Hubei province in the previous 14 days will have an additional health assessment. They will be screened for fever, cough, difficulty breathing. If symptomatic, American citizens and those who are exempt will be transferred for further medical evaluation. They will not be able to complete their itinerary, and they will be isolated for 14 days. If asymptomatic, American citizens and those who are exempt will be subject to a mandatory 14-day quarantine at or near that location. We are preparing as if this were the next pandemic, but we are hopeful still that this is not and will not be the case. This is the first time in over 50 years that CDC has issued a quarantine order. While we understand this action may seem drastic, our goal today, tomorrow, and always continues to be the safety of the American public. The information that's coming in from China suggests that there is significant mortality associated with this disease. However, it is very difficult to use that information to calculate a case fatality ratio, and as you know, the case fatality ratios for flu differs year by year. We also know that there are biases in reporting of diseases in general. We have found that more severe disease tends to be reported first, which may throw off a calculation. We also understand that the initial case definition in China really focused on patients with pneumonia, and so it's not clear what the case fatality, the pure case fatality ratio is right now, and therefore it's difficult to compare to flu. But what I would say is that there clearly are deaths being reported out of China, and that's concerning. The actions that the federal government is taking are science-based with the aim of protecting the health and safety of all Americans. Please do not let fear or panic guide your actions. As we've said, this situation continues to evolve, and our guidance, our operations, our implementation continues to evolve rapidly as we try to synthesize the risk. We've made this decision. We understand its historical significance. We are working with the State Department to fully understand these other repatriated individuals, and as we develop more concrete plans, you will certainly know them.
Sacar de Wuhan, China, el epicentro del coronavirus, que ya ha cobrado la vida de más de 100 personas en el país chino y se ha reportado, ya se ha expandido por varios países a nivel mundial.